Good afternoon. Today we work today as the Rheumatoid Arthritis Awareness Day with the basic intention to make both public as well as the patients suffering from rheumatoid arthritis to know about it actually. And because quite often we are very much ignorant about these kind of common but little less common kind of disease. So why one should know about disease is that if you know what the other person is suffering from, you will be able to guide them. If bad luck strikes you and you develop this disease, you know what to do with this particular problems. So rheumatoid arthritis is managed by rheumatologist, and I am Dr. Chandrashekara S, Medical Director of Chandra Rheumatology Immunology Center. And I am trying to share you about the concept in my best ability to be explained at the common man's language actually. So what is rheumatoid arthritis? When we say a rheumatoid arthritis, we always say it is an autoimmune disease. What does the autoimmune disease means? When we say when an immune system which is being designed to protect us from the infection, that is by fighting against bacteria, virus, or anything which come from outside. Instead of that, it starts attacking your own body structures like either joint, kidneys, or any other part. Then we call it as autoimmune disease. Autoimmune disease is not a rare disease. It's considerably a common disease. It is supposed to occur at a rate of around 1% of the population. So you can say every 1 out of 100 will suffer from this disease. If you include thyroid and other diseases, the percentage increases very significantly, very high. So rheumatoid arthritis is a sort of autoimmune disease wherein immune system by error starts attacking your joints, slowly over a period of time can attack other structures. So what exactly happens in rheumatoid arthritis? As soon as the disease process starts, there is a sort of incubation time wherein the autoantibodies, etc. would have set in, and gradually they mature and start developing symptoms what an individual can perceive. And slowly as the time progresses, the number of joints get increased, the number of joints getting damaged increases, and slowly the person becomes incapacitated. What we see is by the end of 2 years, we start seeing quite a good amount of damage. By the end of 10 years, more than 60% of the patients who are not properly treated for rheumatoid arthritis become disabled. What causes rheumatoid arthritis? See, there is a lot of confusion on rheumatoid arthritis. We say it could be partially hereditary. When I say partially hereditary, it's not that like if your parents have rheumatoid, you are likely to get the rheumatoid. If your parents have rheumatoid, your chance of getting rheumatoid is little higher than a person whose both parents don't have rheumatoid arthritis. So rheumatoid arthritis have some amount of genetic element. What we mean is individual should have a susceptibility to develop the disease. When that happens, because of environment, exposure to infections and exposure to varieties of others, including lifestyle like smoking. Smoking has been very well attributed for the development of rheumatoid arthritis, can result in the erring of the system, of immune system, and resulting in arthritis. How does a rheumatoid arthritis starts getting manifested? Person may have joints pain, may have tender joint, there may be a swelling with stiffness. He may, especially when you get up in the morning or rest for a long time, your joints, especially hands, legs become stiff. Because of pain, you may have difficulty to walk. Slowly, if you don't take treatment properly, you may not be able to do the work. One may lose weight. One may have a low-grade fever. You have severe fatigue. You feel as if you have done a lot of job. And the joint deformities start setting in. One may also develop anemia. There is a drop in hemoglobin. So in addition to that, you also may have nodules. Small knots can come on the skin. And you may have muscle weakness secondarily because you are not moving the joints much. And the bone loss may result in osteoporosis and fractures. In addition to that, as the rheumatoid arthritis progresses slowly, it may also involve lung, resulting in breathlessness, can have dry cough, and also may start involving eye in the form of dry eye, scleritis, painful eye, and vision problems. And other complications like vasculitis, wherein it can break the nerve by blocking the circulating vessels. It can cause dry eye, dry mouth, and it can produce poor sleep, chronic fatigue. And as a consequence of all put together, you will end up in depressions and so many other social complications. And it's also been shown that patients who doesn't take a proper treatment for rheumatoid arthritis, they may land up in having an increased risk of heart attacks, because it is supposed to accelerate atherosclerosis, that blocking of the vessels. So how exactly we can say that an individual suffers from rheumatoid arthritis? Doctor to whom you visit, especially rheumatologists, will take a detailed history. What did you have? When did your joints pain develop? Which are the joints which got affected? So did you develop deformities? What are the joints involved? Based on that, then he will examine you to see for what joints are involved. The joints are really swollen, tender, and all these informations put together. He suggests you to do some tests like rheumatoid factor, anti-CCP. If those two tests are positive, the possibility of you having rheumatoid arthritis is likely. See, one point one should remember, just positive rheumatoid factor doesn't mean you have rheumatoid arthritis. You should have a joint pain, because 5% of population may have rheumatoid factor. Whereas anti-CCP is normally not seen in a normal individuals. Presence of anti-CCP in majority of the circumstances tells you all probably have a rheumatoid arthritis. Rising CRP, rise in ESR, what we call as inflammatory parameters, when they are present, they suggest a rheumatoid arthritis possibility. X-ray may show or help you to get us the diagnosis. So overall, laboratory test helps in making the diagnosis of rheumatoid arthritis. We don't have a lab specific test like rheumatoid factor, which can 100% tell you that you have a rheumatoid arthritis. You need to look into the possibility of clinical signs and match all of them together and come into conclusions. So how do I treat a rheumatoid arthritis? So we treat rheumatoid arthritis to relieve the pain. We use painkillers like NSAIDs, physiotherapy, and others. We use a very important drug, what is called as disease-modifying anti-rheumatic drug. Here comes the point. The patient who suffers from rheumatoid arthritis, in addition to getting his pain relief using pain relievers, he should get himself treated with disease-modifying anti-rheumatic drug. See, as the word goes, the disease-modifying anti-rheumatic drug, its most important thing it does is, in addition to the reduction of swelling, it also stops the deformities developing. That's why we use a term called as disease-modifying anti-rheumatic drugs. We have many drugs like that. We have methotrexate, we have several drugs which can definitely stop the progress of a normal hand to a deformed hand. So the main objective in treatment of rheumatoid arthritis is not just the pain relief. Pain relief can happen just taking painkillers, etc. What we objectively aim at is to reduce the deformities and disabilities which otherwise come in rheumatoid arthritis. So if we initiate these disease-modifying anti-rheumatic drug, it can prevent deformity, it can prevent complication of the disease. We have seen of late a complete cure of the disease. The disease may almost go for a remission. Because of all these benefits, the quality of life will be improved. So that makes a point clear. Get your rheumatoid arthritis diagnosed early, seeking a right physician's approach, right rheumatologist approach, and put yourself on the right treatment with disease-modifying anti-rheumatic drug. So thereby, you can prevent deformities, prevent complications, if possible, if things work out, to get the disease, get rid of. In addition to that, you need to understand what is your disease. You need to do a lot of exercise. And if there is deformities, physical and occupational therapy will help. Individualized exercise programs, improving resistance, mobility, aerobic exercise, they all improve. Balancing training and splint, braces, orthotics, they all can help. In addition to that, if you are smoking, stop it. I said very clearly in the beginning, smoking could be one of the trigger factors for the development of rheumatoid arthritis. And alcohol should be avoided for the good of side effects and others. So in addition to that, good walking, swimming, yoga, walking, tai chi, weight training, hiking, they all helps you in having a good quality of life. Sometimes it can also prevent the prevent the deformities, disabilities, and improve the quality of life. Physical therapies improves the mobility. It reduces inflammation, enhances joint mobility. It also helps in managing pain, reduces the cardiovascular risk, and improves sleep quality. So indulge yourself in exercise, also undergo a good physical therapy and training. And of course, the diet don't have a direct influence on the rheumatoid arthritis. There are some says that if you indulge in more vegetables, more green leafy vegetables, it can help you in reducing the rheumatoid arthritis pain. So they talk of Mediterranean diet, fish, etc. But however, we don't have a specific diet to rheumatoid arthritis relationship. So that's why we simply say that no diet can cure your rheumatoid. It may help you, but if you psychologically feel you better, you can indulge in using some of the diets. But one thing should be very clear, you should never become obese, because already hurting pain joints can get pain, worsening of pain because of your weight. Quit smoking and alcohol. That literally helps you with reference to pain management. That's the best advice we give with reference to diet. The other possibility is there could be a loss of bone mass because of the arthritis per se. Sometimes we may have to use steroids for a short time. And women who goes menopause, there could be a reduction in bone mass. So at that time, we may use some of the drugs, including simple calcium, vitamin D supplement, some of the medications like bisphosphonates, etc., which can help you in keeping a good bone mass. So in a nutshell, when we are treating, we have pain relievers, we have disease-modifying anti-rheumatic drug like methotrexate, leflunomide, and biologics and targeted DMRs, other supplements like calcium, vitamin D, and wherever required, a short course of steroids really do a wonderful job. See, the patients of rheumatoid arthritis, we have seen in the last 2 decades. In the 2 decades back, when we didn't have much of these drugs in the lower fund, with only methotrexate and a possible use of steroids, the patients used to come with a lot of deformities and disabilities, which are significantly reduced. But the key to get this is to diagnose the rheumatoid arthritis early and introduce this disease-modifying anti-rheumatic drug in the early course of the disease. So the treatment may last sometimes 2 to 5 years, unusually may be lifelong. If treated early, chance of getting cured is very high. If you intervene the treatment in the first 6 months, chance of going for a drug-free remission is very high, which significantly drops down if you cross 2 years. So medication shouldn't be stopped once the pain disappears. More often we feel pain is gone, rheumatoid arthritis is gone. Why should I unnecessarily continue the medication? But that's not correct. If the patient, still the signs of rheumatoid arthritis completely regressed or established by your treating rheumatologist, and continue the medications. Ask him, can you stop? The day when it can be stopped, he will help you and guide you in reducing the medications. Do not discontinue medication abruptly. Look into the advice of the doctors. In case of an incomplete treatment, the disease may relapse. Relapse could be worse than what it was in the very beginning. So regarding complementary and alternative therapies, we are not very sure of how much it can help, but some of the massage therapy can help you in temporary pain relief. Yoga therapy can complement you, especially mind-body technique in help in relaxation, and meditation can improve the quality of life. But let's be clear that it's not the treatment. What I mean is, it's not the one which goes for a curative treatment. Disease-modifying anti-rheumatic drug is a necessity. These therapies can help you as a supplementary or a complementary to what's going on in the mainstream, can help you in improving the quality of life. Can a patient suffering from rheumatoid arthritis become pregnant? Answer to that question is yes. She can conceive. The only thing is you need to discuss with your doctors, because some of the drugs are not allowed during pregnancy, because it can cause a minor damage to the growing embryo or fetus, and discuss with your rheumatologist before planning pregnancy. For example, methotrexate should be stopped at least 1 month before trying to conceive. Keep the disease activity as less as possible, and symptoms usually may improve during pregnancy. Sometime it may worsen. So you need to plan the pregnancy so that you don't expose the baby to unnecessary medicines and you are also comfortable through the pregnancies. So in a nutshell, the treatment of rheumatoid arthritis is not just the patient and the doctor. Families have to support, friends have to help. Many doctors may have to take care parallelly for any others. And of course, a lot of research input is required for a newer and a better development. And we need sometimes these patients, because of the disability, are unable to support themselves, may need fundraising, volunteers to help these patients. Often these patients, when they become incapacitated or neglected, they need a total attention and help. And in this Rheumatoid Arthritis Awareness Day, I would request all the people who are capable of helping, supporting the rheumatoid arthritis patients or any other connective tissue disease patients to come forward and donate liberally into our trust called IRET Trust, which supports quite a good number of these patients for themselves to support. Thank you very much for patience hearing.